Swayam Prabha. Digital India. Educated India.
Namaste. We covered two topics related to Ayurveda so far: the evolution and history of Ayurveda and its basic concepts. Now let's look at what is the Ayurvedic approach. How does Ayurveda apply these concepts for the prevention and treatment of diseases? Now, it's very important to emphasize that Ayurveda gives, equal weightage to both prevention and cure. It's Ayurveda is sometimes we say it's more about prevention and less about cure. But that's not true. It says both prevention and cure are two sides of the same coin. Preventive medicine in Ayurveda is called as Swasthavritam, and the branch dealing with treatment of diseases is called as Aturavritam. So Ayurveda, the whole scope of Ayurveda itself is divided into these two arms, Swasthavritam and Aturavritam. So Ayurveda, of course, then gives more emphasis on prevention than cure, but does not neglect either of these, branches of medicine. Now, when you come to Swasthavritam or preventive medicine, one thing that Ayurveda focuses is on how to prevent disease for each individual. So the Ayurvedic texts clearly say that preservation of health and preservation of disease is achieved by the good conduct known as Sadvritam. That means how we must live our life, what should be our attitude. The regulation of one's lifestyle by following daily regimen, this is called Dinacharya, right from the time when to wake up, what to do immediately after waking up, what all activities we should do in sequence in such a way that our health is preserved. And how do we change this according to seasons? Because we know in different parts of the world there are different seasons. In India, North India, the flow of seasons are different from that in South India. So changing your lifestyle and your diet according to the season, this is called as Ritucharya. So if every individual follows these three things, Sadvritam, Dinacharya and Ritucharya, then they can, prevent the manifestation of diseases. Ayurveda also lays great emphasis on healthy diet. In fact, which it is also well known today that 70% of the diseases that plague humanity are lifestyle diseases. If we can correct our lifestyle and diet, we can actually deal with 70% of the diseases that affect people all over the world. So Ayurveda says that the meal should be delicious, nutritious and assimilable. Now when you come to community and environmental health, this is also another aspect of Swasthavrita, and the Ayurvedic texts point out that in order to prevent communicable disease, we must keep our environment clean by preventing land pollution, water pollution and air pollution. So in Charaka Samhita, in a chapter called Janapadodvamsa, these things are discussed. The 4 factors which cause, the entire communities to be destroyed. So the Ayurvedic understanding of epidemics, pandemics, they are all described in this chapter called Janapadodvamsa. Janapada meaning, large human community, and Udvamsa means destruction. So sanitation and hygiene, sustainable exploitation of nature, all this is emphasized. In our modern way of life, we are over-exploiting nature. We are damaging the land. We are damaging the water resources around us. We are polluting the air, that we breathe. And all these things in due course of time will lead to manifestation of environmental problems that will have great impact on human communities. So unsustainable practices are called adharma, and this Ayurveda was one of the earliest medical systems to warn about climate change, which is called as the Dushti of Kala or Kala Dushti. and climate change can lead to destruction of the planet. So Charaka says Kala Dushti is the eventual outcome of Desha Dushti, Jala Dushti and Vayu Dushti, land pollution, water pollution and air pollution. The renowned surgeon Sushruta extensively discusses about transmission of diseases. So Ayurveda discussed about communicable diseases. So two of the significant diseases prevalent during that era are specially mentioned: leprosy, Kushtha, and tuberculosis, Kshosha or Kshaya. But various other types of fevers, conjunctivitis, these also were understood to be transmitted, from one person to the other. So the Sushruta Samhita also highlights the mechanism of transmission of these various diseases, and this include, the following: prasangat. Prasanga means physical close contact. If we are in close contact with a person who has a communicable disease, then it will spread to us. And we know recently COVID was the biggest example of how prasanga or close physical contact can cause the spread of communicable diseases. Gatra samsparsha, touching, while prasanga is a close contact, there is no touching. If you go one step further and touch another person, you are having a still higher risk of contracting infectious diseases. This is called Gatra Samsparsha. Nishwasad, a lot of communicable diseases, especially respiratory diseases, and COVID also an example, are transmitted from one person to the other by Nishwasa or inhalation of infected respiratory droplets. Once again, COVID is the best example in this case. The other methods of communication are Sahabhojanat, sharing food, eating together, from one plate. Sahashaya, sleeping together. Sahasana, even sitting together. So we had this great effort of, social distancing, where even chairs, there was a gap kept between chairs for people to sit during COVID. So Sushruta has mentioned all those procedures. Vastra dharana, even sharing clothes of an infected person can lead to transmission of infection. Malyanulepanat, sharing flowers or jewelry of an infected person. So these are some of the mechanisms of communication of diseases that are discussed in the Sushruta Samhita. Now we look at how Ayurveda understands disease. So Ayurveda uses a five-fold diagnostic method or framework called Panchalakshana Nidana, which helps the physicians in reconstructing the etiology of a disease. This is very similar to a detective constructing a crime scene. When a detective comes to a crime scene, he or she will collect all the available clues and then they will put them together just like solving a jigsaw puzzle and trying to understand what happened. So they will go back to the sequence of events that unfolded as the crime was committed, and eventually if they are really clever enough, they are able to catch the culprit. Compared to that, in medicine, when a doctor diagnoses a disease, he is actually looking at a crime in progress. The crime has not yet been committed. The patient is not yet dead, but the disease is progressing. And just like a detective, the physician also collects all the clues that are possible to be collected by looking at the signs, symptoms, the various findings of examination, and then putting all this together, stitching all these clues together. The physician also makes up an understanding of what would have happened, how the disease has progressed. And this helps the physician to understand the entire sequence. This is called as pathogenesis, or the whole development and progression of the disease. Now conversely, we also have a supportive six-fold mapping of disease progression, which is called Shat Kriya Kala, and this facilitates the comprehension of the disease's future natural course. So the Shat Kriya Kala helps us to understand the natural course of the disease. How the disease, what will happen if we don't do any treatment, and what are the pivotal or the critical points for medical intervention to halt its progression. So Panchalakshana Nidana is like looking back to understand what has happened, and Shatkriya Kala is like looking forward to predict what is going to happen. So in this way, by looking both retrospectively and prospectively, the Ayurvedic physician tries to get a complete and comprehensive understanding of every disease before starting the treatment. Now let's look at the fivefold method of diagnosis. The fivefold method of diagnosis, which we just referred to as Panchalakshana Nidana, consists of 5 steps. First, understanding the Nidana, tracing the causes of the disease. What actually caused the disease? It could be a single cause, it could be multiple causes, and it takes a lot of time. How do we know the cause of a disease? By seeing the effects. Most of the time, when we understand what has happened in the patient, we can trace back and make predictions about these are the possible or probable reasons or causes. This is followed by Purva Rupa. Many diseases show premonitory signs before actually manifesting in a full-fledged way. So this is called as Purva Rupa. In a cancer of the mouth, it may be just a discoloration to begin with, which later, if it is ignored, can develop into a tumor. So the Purva Rupas help us to predict, the arrival of a disease much in advance. And in that stage, the disease may sometimes even be, treatable. So Purva Rupa is given a lot of importance in Ayurveda. Rupa is the actual clinical signs and symptoms of the full-blown disease. And when we make a tentative assessment of a disease, we may give a test treatment. This is called Upashaya. If the treatment works, the patient responds to the treatment, then it confirms the diagnosis. If the patient doesn't respond to that treatment, then it means our diagnosis was wrong. And putting all these things together, explaining how the Nidana or the cause caused the imbalance of the doshas, how the imbalance of the doshas led to the development of a disease, and how the disease finally manifested. This story of the development of the disease is called Samprapti or pathogenesis. Now let's look at the other framework, the 6-fold method of prognosis. It starts with Sanchaya. Sanchaya means this is an incubation period where the doshas Vata, Pitta and Kapha build up in an abnormal amount, and this is followed by Prakopa. So Prakopa is the breaking point phase where the normal boundaries are crossed. Now the body is entering into a state of imbalance. The critical boundaries are breached. Whereas Sanchaya is a very silent stage in which the body elements are accumulating abnormally but have not yet crossed the boundaries. Once the boundary is breached, then we move into the Prasara stage or the spreading phase, where the increased dosha starts spreading to other parts of the body. This is just like if you have a lot of cholesterol in the blood and then it is spreading everywhere, it begins to move to different organs. It can get, deposited in the liver. That stage is called as Prasara. So after Prasara, as the doshas spread all around, they begin to localize, they begin to locate themselves, they begin to deposit in some areas. In this stage, it may deposit in some arteries and cause blockages, or it may deposit in the liver and cause fatty liver. This is the stage in which the doshas are settling in an organ, and then it starts initiating the disease process. And in the next phase, we have the Vyakti. So people may have fatty liver for a long time, but then when it turns to inflammation, turns to scarring of the liver tissue, then it becomes Vyakti. This is a stage of manifestation where the clinical symptoms appear and start to develop. So you are able to now diagnose the disease because the patient presents with many symptoms. Finally, we have Bheda. This is a stage of complications and terminal illness. And usually in the Bheda stage, it is not possible to reverse or cure the disease. Only palliative care may be possible. Now that we have understood how Ayurveda, diagnoses disease, and please also recollect our previous sessions where we said Ayurveda understands disease in terms of, derangement, imbalance of the dhatus, derangement of the doshas, inability of the body to remove the malas. Now we will look at how Ayurveda treats diseases. So Ayurveda says in order to treat disease, we have to avoid the causes and reverse the disease process by a variety of methods. Ayurvedic treatment is what we can call as multi-modal or holistic. It's not just about swallowing one pill or taking one injection. Ayurveda says that we have to bring about many changes. We have to change the mindset of the patient. By changing the mindset of the patient, the physician convinces the patient to make changes in lifestyle. Then after making lifestyle changes, the physician advises about how to go on to a healthy diet. And only after doing these things, the internal medications are given. Because medicines by themselves will not be effective if you don't have the right mind stress. If the mind should not be stressed. In a very stressed state, even taking medicines may not be effective. So Ayurveda talks about mental counseling, lifestyle changes, dietary regimen, and then the administration of internal medications, external therapies. It is a misconception that Ayurveda is an escape from surgery. No, Ayurveda was one of the pioneers in surgery worldwide. And surgery, alkali and cautery are the last resorts. If other medical methods do not work, Ayurveda also recommends surgery. And this is how Ayurveda, treats diseases. This is the general approach towards treating a disease. We will not look at mental counseling, lifestyle and diet because we did give a brief indication of it when we discussed about prevention. Let's look at internal treatments. Now, internal treatments are either pacificatory, shamana, which means taking herbs and herbal formulations. Sometimes these contain products derived from animals and also metals and minerals. The other method is cleansing or shodhana. So the famous treatment procedure called Panchakarma in Ayurveda comes under the cleansing method of treatment. Now, Panchakarma includes many procedures. In fact, actually 5 procedures. That is why they are called as Panchakarma. Pancha meaning 5 and Karma meaning procedure. So, it includes therapeutically induced vomiting, purgation, which means taking strong laxatives, purgatives, decoction and oil enema, and nasal cleansing. Now, Panchakarma is something which should be done under the guidance and supervision of a qualified Ayurvedic physicians. It's not simply taking emetics or purgatives. There's a lot of preparation that the body has to undergo before doing Panchakarma. And some people may not be eligible. I mean, they may not be in the physical condition to undergo Panchakarma. So, this branch of Ayurveda has now become an independent discipline. Today's Ayurveda doctors are specializing in Panchakarma. And before you undergo a procedure of Panchakarma, elaborate evaluation and assessment will be done. So an ideal combination of purificatory and cleansing therapies aim to restore the balance of the physiology of the body. So this is what you can expect when you come to an Ayurveda physician for treatment. He might either just give you only pacificatory shamana treatments, which means after correcting your diet and lifestyle and giving you some counseling, the Ayurveda physician will administer herbs. But sometimes the Ayurveda physician may also decide that you need cleansing therapies. The cleansing therapies may be 1 or 2 of the Panchakarmas, then in which case it is simply called as Shodhana. But if all the 5 procedures are done, then you are subjected to Panchakarma. Now, just as we do therapies internally, Ayurveda believes that we must also work externally on the body. So that is what makes Ayurveda comprehensive. There is internal medication as well as external therapies. So external therapies include application of pastes or powders on the body, doing powder massage, oil massage, applying herbal mixtures as bolus to do fermentation. This will actually loosen the muscles, the tendons. It will improve circulation. And there are various methods of massage, that are practiced. And therapeutic massage loosens the joints, restores health of muscles. It improves circulation and also aids in cleansing the body. So today, a lot of people, not only in India, but also outside India, are specializing in Ayurvedic therapies, and they become Ayurvedic masseurs. So just like in modern medicine, we have a branch of physiotherapy. In Ayurveda, massage therapy and other therapies are becoming an independent discipline. So here is a indication of the kind of medicines that an Ayurveda physician, prepares and dispenses. So some of the Ayurvedic medicines may be water extracts, which means they are extracted in watery medium. So this include kashayams, decoctions, Fanta hot infusions, which is just like herbal tea, Hima cold infusion. If you use a cold water to make a tea, then it is cold infusion. Swarasa or fresh juice, where we squeeze the plants and take the juice. Some medicines are made by burning the materials, especially metals. Even plants are burnt, that is incinerated ash. So they are called as bhasmas and sinturas. Some medicines are made in fatty medium, which means we extract the ingredients of herbs in oil or ghee. So if it is taken in oil, it is called thailam. If it is taken in ghee, it is called ghridam. Ayurveda also uses self-generated alcohol. Some herbal combinations are fermented and they generate alcohol, and these become medicated wines like Asava and Arishta. And then we also have, dry extracts where the herbs are dried and made into powders or rolled into pills. So this is when you visit an Ayurveda physician, you may get any of these forms of medication, sometimes a combination. So here are the 5 therapeutic procedures: Vamana, therapeutic vomiting; Virechana, purgation; Kashaya Vasti, decoction enema; Anuvasana Vasti, oil enema; Nasya is a nasal purge. So together these constitute the internal medications that Ayurveda uses. So you can see that this is the complex Ayurvedic prescription. When you go to an Ayurveda physician, you can see here this is the framework of an Ayurvedic prescription. The Ayurvedic physician will not just give you a few medications. The Ayurvedic physician will go deep into your life. The purpose of Ayurveda is to transform our lives, bring about radical changes in the way we live. That is why it is called Ayurveda. So it includes counseling to reduce your stress, to give you a perspective, understanding of how and why you got the disease and why you must change your lifestyle. What changes you have to bring in your diet, that is the next step. So this is very, very important. No medicines are prescribed without counseling, lifestyle and diet. And then we give internal medications, just as you saw in the chart before. Any one of those watery extracts, fatty extract, self-generated alcohol, wines, or dry extracts, or incinerated ash, any one of these may be administered. And then this is followed by external therapies like oil massage, powder massage, or fermentation. And if all these things do not work, then surgery is also advised, and even more drastic measures like alkali and thermocautery. So this was an overview of how Ayurveda looks at preventive medicine as well as curative medicine, Swasthavritta and Aturavrita, building upon the basic concepts of imbalance, disease, health, prakriti or individual constitution, using the framework of Panchalakshana Nidana, the 5-fold diagnostic method, the 6-fold assessment of the natural course of the disease, or Shat Kriya Kala. Ayurveda gives you a comprehensive understanding of the disease, and its interventions are holistic. That is what we understood in this discussion. It is not just about giving some medicines or pills. It is about changing our lifestyle, and with the diet, changing our mindset. In this background, when we take these medications and interventions, we can hope to bring back the body's ability to heal itself. So Ayurveda is all about healing our system, and not just about intervention from outside. In order to deepen your knowledge of this topic, here are some additional readings recommended. Professor M.S. Valyathan, the great cardiovascular surgeon, has written an introduction to Ayurveda, published by Orient Black Swan. And Kotari YK has also given an introduction to Ayurveda, published by Chaukamba, Varanasi. So I strongly recommend that you go through these readings to deepen your knowledge about treatments in Ayurveda. Namaste.